The way technologies have changed, my son practices with me, so he's a lot more savvy about some of the technologies that are available now. And, but even I, at my old gray-haired age, could tell this whole technology about video and Google and people finding things on the internet, I could see that was just a remarkable thing. It's very evident how different this is when, for instance, my son and I have both been down and been on these talk show things with the pretty girls that are talking about cooking and all these other things. And we've been down there and talked about technical things and some of the new breakthroughs in dentistry. Those are very expensive things to do. And the return on that investment has just not been anywhere near the benefits that we get. And I believe it is because when somebody wants something from me, they want to go find somebody who they believe is credible, somebody they think is an authority in that area. And with the remarkable things that Google's doing, they can type in one word. And with that one word, they'll find me because the Dental Network News is putting out such good content, such an abundance of content, that it moves us way up on Google searches. You know, the video that this is doing for us, I think is absolutely the most powerful part of it. I have specialists that I refer to, and so I've gotten them involved with the Dentist Network News. And even within our practice, when I tell somebody they've got to go get a root canal, they don't want to leave my practice. They want me to do the root canal. I haven't done one in 35 years, but they're begging me to do a root canal. So I can show them a network news program that the root canal guy has done. And when they watch that, my staff shows them that, they're very comfortable going over there and meeting with Dr. Doyen or with Dr. Rhoda. So the video within our own practice has helped our patients see who they're going to. And I think that just reflects how powerful it is for the public when they see me on video. They come in and they almost feel like they kind of know me just from seeing me talk. When we went down and we were on Channel 3, that gave me dry mouth and made me a little bit nervous because it's really live. With what I've done here, we can shoot these things, and I know that you're going to be able to edit this thing, so it really makes me a lot more comfortable to be able to just sit and talk about the things that I know. You know, I can remember 5 years ago being at a seminar and they were starting to talk about get a web page and you got to do these kinds of things. And Brad was, my son was at some of these, and he said, yeah, we got to get a web page, Dad. So we got a web page. Since then, we've probably had that web page redone 3 or 4 times because technology changes. And so I have IT people now who come into my practice as a new patient and say, part of the reason I'm here is because I saw you and you look like you're an authority in what you do, and I found you everywhere. I couldn't search anything without having your name come up. So here I am, I'm your patient. I think the raw numbers on that, probably 30–35% of the new patients that we see every month are coming in now simply because they've Googled us and found us all over the internet.